Telehealth physical therapy has been booming in the last couple of months ever since COVID-19, social distancing, and quarantining because it was no longer deemed safe to go out in the community, otherwise you would risk getting the virus. Telehealth physical therapy is not something that was always covered for health insurances. However, since COVID-19, a lot of insurance companies are actually allowing in-network and out-of-network physical therapy sessions to be had via telehealth. In addition to that, a lot of the costs are completely waived: co-pays, co-insurances, and deductibles. With that said, I have been seeing a lot of patients online via telehealth physical therapy over these last 2 months, and I want to explain to you what happens during a telehealth PT session. My name is Dr. Gretchen Hawley. I'm a physical therapist and a multiple sclerosis certified specialist. I created this YouTube channel to hopefully help you champion your life with MS. There is a big difference between orthopedic physical therapy, which is the type of PT that you would normally go to after an injury or maybe even after a surgery, and MS-specific physical therapy, which is functional and helps you increase your independence and quality of life through movement and strength and balance. So today I am going to show you exactly what we would do during a physical therapy telehealth evaluation and follow-up visits. The very first thing that we would do during a physical therapy evaluation is a subjective portion, which pretty much would be me or your other physical therapist that you're working with asking you a lot of questions to get specific information about the MS that you are dealing with. Are you suffering from primary or secondary fatigue? Are you having falls or near falls? What issues do you have on a day-to-day basis? What goals are you working towards? There are so many questions that are really important for PTs to understand in order to give you the best exercises and help you reach your goals. So this subjective talking portion typically takes me about 15, sometimes 20 minutes so that I can get a full vision of what you are doing with your MS, how you're living with your MS, how it's affecting you, and how I can best help you. From there, we move on to looking at your strength. Now, in the physical therapy clinic, it would be very common for me to ask you to maybe lift a leg, and I would push down on your leg to see how strong it was. With telehealth physical therapy, it's impossible for me to put my arm through your screen and push down on your leg. So I do look at strength and your range of motion, but not in the sense of how much can you resist me, more so just to see what motion you do have. I can get so much information based on what is limiting your movement just from watching how you move your legs and how much you can move them. So for example, the test that I do for strength, I would have you lean back, and I personally want to see how much can you lift each of your legs. Can you straighten your knees? Can you bend your knees behind you? And also, can you lift your ankles up and your heels up? These are the most common muscle groups that get weak from multiple sclerosis, and they are also the most common muscle groups that you need strength in order to walk well. So if you have difficulty with any one of those movements, then that is going to indicate some exercises that we will be doing in our follow-up sessions. The next thing we look at is balance, and there are several different positions that I look at for different reasons. The first one is having your feet apart, and this one I like to look at just to see how long would you be able to stand without holding on to anything in order to have a conversation with someone or while you're brushing your teeth. If you have difficulty standing with your feet about a shoulder distance apart, then that is going to give me a good idea as to what your balance truly is like and what we need to work on. Once we've looked at this position, I will move 2 feet together. And in this one, it gets a little bit trickier, and you'll see they get trickier as we go on. So I do want to make sure that my client is having something to hold on to nearby so that if you do feel a little bit tippy, you have something that will prevent you from falling. Once you practice standing here, I then want to see what your staggered stance looks like with your right foot forward and left foot back, about shoulder distance apart, and we do the same thing on the other side. The reason this one is really important is because when you are walking, when all of us are walking, we are in staggered stance for a piece of that movement. So if you have difficulty balancing in a staggered stance, you're probably going to have difficulty walking. So I like to look at this one. The next one is tandem stance, one foot directly in front of the other. As you can see, I'm a little wobbly with this one. And I would practice on this other side as well with the opposite foot forward. The reason I like to look at this one is because every now and then when you're walking, sometimes your foot doesn't land where you want it to go. So if I'm walking forward, ideally my foot would land right here. But sometimes it will land across my body. And if that's the case, I need to make sure that I have good balance in this position. The last balance position that I look at is single leg balance. Admittedly, this is the hardest one for most people, including myself. But what you would do is stand on one leg with your knees slightly bent, other leg comes up. How long can you balance here for? Similar to the staggered stance walking, there is a moment throughout our gait cycle where we are only on one leg. So especially if you're not using an assistive device, you need to be able to balance on one leg in a solid way for at least a couple of seconds. If not, that is going to impact your walking. For all of these positions, the feet apart, feet together, staggered stance, tandem stance, and single leg stance, I am looking to see how long you can balance for. The goal is up to 20 seconds, but even if it's just 1 or 2 seconds, that is fine. All of these measurements on day one are not indicative of your level of disability moving forward. It's just a baseline number. One thing that I love implementing into my evaluation sessions are functional outcome measures. There are 2 subjective functional outcome measures that you will fill out before we even have our evaluation. And those 2 are the Modified Fatigue Impact Scale, which tells me a bit about your fatigue and how it may or may not be impacting your life. And then the second one is the MSWS-12, which stands for the Multiple Sclerosis Walking Scale 12. And that gives me a good idea on how you feel your walking is in specific situations. There are also a couple of objective functional outcome measures that we do during our evaluation as well. Subjective measures mean that it is getting your input on how things are going, whereas objective means I am actually measuring and we're getting a number for that test. The first objective functional outcome measure that we do during a telehealth evaluation is the 5 times sit to stand test. So you start in a seated position and then you stand up and then sit down. You're more than welcome to use armrests if you need to or to push off of your chair. Regardless, you're standing all the way up and then sitting down 5 times. And I am timing you to see how quickly you are able to complete 5 sit to stands. The second functional outcome measure that we will do is the 30-second sit to stand test. This is very similar to the 5 times sit to stand, but I promise there is a difference and there's a reason that we do both of them. The 30-second sit to stand test means that you just stand up and sit down as many times as you can in 30 seconds. So I have my timer going, you're sitting down and standing up, and at the end of 30 seconds I stop my timer and I write down the number of repetitions that you were able to do. Both the 5 times sit to stand test and the 30-second sit to stand test give me a great idea as to what your current mobility level is like, and it also gives us a great measurement to work on as a goal. The quicker you are able to stand up and sit down and the more repetitions you're able to do directly relates to how your function is throughout the day. There are 2 other functional outcome measures that I would do if I was in the physical therapy clinic with you, and we still do them via telehealth, but it's with a little bit of a twist. The first test is the timed 25-foot walk test. Now, typically, this test would mean you are in a long hallway that has tape at one end and the other end that marks 25 feet. You're standing at one end, you walk as quickly and safely as you can down to the other end, and you're timed that whole time. Now at home, you might not have 25 feet uninterrupted. There might be some furniture in the way or some reason that you can't walk 25 feet straight. So the way that we implement this functional outcome measure at home is that we'll have you stand at an object that never moves. Maybe it's a doorway or your TV or something that just doesn't move. It doesn't fall out of the way. You can't push it. It's just a heavy thing or an immobile object. So you stand there and then you pick something that's about 25 feet in front of you. Maybe that's a heavy dining room table or another doorway or a chair that never moves. So the idea is that you're starting and ending at objects that don't move. They will always be exactly in that same position. Now that distance might not be 25 feet. It might be 10 feet or 30 feet or 50 feet. However, the goal is that you want to time yourself from one end to the other, and then that first measurement on that first day of telehealth PT is the baseline measurement. Then next time we test it, we can be certain that neither object has moved. The second functional outcome measure that we do via telehealth is the timed up and go. Again, this one does look different if you are in the physical therapy clinic. If you're in a PT clinic, you will be sitting in a chair and then you stand up, you walk 10 feet down, turn around, come back and sit back down. However, the same issue for the 25-foot walk test appears here. You might not have something in front of you, a space in front of you that is a full 10 feet, but that is okay. The way we work this one into telehealth PT is by sitting in a chair, any chair, stand up and walk down to an object that doesn't move. Maybe it's a table, maybe it's a doorway. It doesn't have to be 10 feet. It might be a little bit shorter, it might be a little bit longer, but it doesn't really matter because when we repeat this test, it's going to be the same distance because you're choosing something that doesn't move. All of these functional outcome measures that I've mentioned so far, including the Multiple Sclerosis Walking Scale 12, the Modified Fatigue Impact Scale, the 5 times sit to stand, the 30-second sit to stand, the timed 25-foot walk test, and the timed up and go, are all tests that we will do during our re-evaluation days. So on day 1, these are just baseline numbers. And the next time we measure them will likely be about 30 days apart or 10 visits. And we will do that every 10 visits or every 30 days. So we are able to see progress. The last thing that we will do during a telehealth physical therapy evaluation is give you some exercises that you can do based on the limitations that I found during our session. These are often just 1 or 2 exercises that are really simple for you to implement throughout your day. And to be honest, a lot of the exercises that I give are in my online MS wellness program, The Missing Link. The main reason that I created The Missing Link is because I had a lot of patients who couldn't come to me in the physical therapy clinic. Maybe it was because they had a high fatigue day, or it was really bad weather and it was unsafe for them to come outside, or maybe they didn't have transportation. Whatever the reason was, there are a lot of things that can prevent someone with MS from coming to the PT clinic regularly. So I created The Missing Link, which is an online platform for patients and people with MS to access these specific MS exercises for strengthening, stretching, balance, and walking, including home exercises. There are also monthly guest speakers that you can join live, as well as research updates. And my favorite section is the task-specific exercise section. So not only will you get exercises specific to common limitations from MS and common weaknesses, but I will also show you activities like how to stand up from the ground, how to climb stairs, how to stand up strong and sit down without plopping. So if you don't currently live in one of the states that I am a licensed physical therapist in, which right now is New York, Massachusetts, and Maine, then you might want to consider having access to my online program, The Missing Link. You can find a video down below that will show you exactly what the program is, so you can see if it would be a good fit for you or not. During follow-up physical therapy visits via telehealth, I am often sitting in a chair or standing demonstrating exercises, and you are on the other end on your computer watching me, and then you do the same exercise that I just demonstrated. And through the computer, I am able to see you, you are able to see me, and it is such an effective way for you to get physical therapy in your own home. And the physical therapist truly is able to see and evaluate how you are moving just from what we see through the computer. So if you feel like you're getting weaker or your fatigue is getting worse, or for whatever reason that you would benefit from physical therapy specific to multiple sclerosis, then I would highly encourage you to see if the PT that you are going to offers telehealth. If not, or if you don't have a physical therapist that knows about multiple sclerosis and you are in Maine, Massachusetts, or New York, please don't hesitate to reach out to me. If you are not in any of those states, you can either consider the missing link or you can do a Google search to see someone in your area that is offering telehealth. I hope you found this video helpful and that you are considering doing telehealth physical therapy. Please remember to share this video with a friend who may benefit from telehealth PT, press the thumbs up button, and press subscribe. And if you have a couple of extra minutes, these are some videos that you can watch that you might enjoy.